Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture Wellness Clinic. Let's talk about wrist pain, elbow pain, shoulder pain, how they're related, and how to easily rehab it at the privacy of your own home. So stay tuned. Okay, so we're all working behind computers. We really don't have a normal range of motion in the wrist. There's a lot of clicking happening, but the wrists are really not moving. The triceps, whose function is to do just that and even beyond, is not really getting to practice because our arms are more in a bent position. And of course, because we're sitting for an extended length of time, shoulder joint is too far forward. That is unfortunately the reality of our lifestyle. So one of the things you need to do is to kind of undo some of the damage you do throughout the day. And what that is not this praying and doing this. I mean, these are fine, but they're really not going to get you where you need to be. The way you want to work your wrist, your elbow, and your shoulder joint all at the same time is very simple. You sit on the floor and you really try to push. Let your whole hand, the whole surface of it, touch the ground and not lift up. It's not going to be like that. It's not going to be this, because the moment that happens, I'm really using this part of my hand to be touching the ground and holding my pressure that I'm about to put behind it. So you don't want to do that. The whole hand needs to be touching the ground, and your hands are as far separated from each other as your shoulder joints without the engagement of your pecs are. So you need to be activating these muscles to pull the socket back. We've already done a video on that, so make sure that you see that. And the hands are as wide apart as my shoulder joints. You can do this against the wall also, so I'm going to show you the wall version as well. So you're going to push into the ground with all of your fingers as well. So I'm not just on one portion of my hands. And just watch my shoulder joint here. As I'm just sitting here, just kind of living on my anatomy, on my bones. My bones being straight are not going to let me fall on the ground. This is the farthest I'm going to fall. So don't be sitting like that. That's horrible. So you want to engage your pelvic floor in this case, which I'm going to skip, but you need to know that's what you need to do. You're going to be pressing into the ground. When you press into the ground with your hands, not pressing into the ground because you're squeezing your legs to lift you up, that's the wrong way of doing it. When you press into the ground, and I'm just going to show you on this side, I'm going to engage the muscles in my forearm on all sides. I'm going to do the same thing here, and the function of these muscles is to pull the socket back the whole time and talk to my pecs so my pecs are not overactivated. You're going to push into the ground to get the maximum length out of your muscles in your arm. Your arm here, your forearm, your upper extremity. And you're going to practice that. And keep your elbow not bent, but straight. And push into the ground, not by grabbing these muscles and lifting them. We're lifting the scaps, but keeping your scaps flat against your upper body and just simply pushing into the ground, and you lift yourself up. You're getting the maximum length out of your muscle fibers. You got to understand this. This is so important. Our tendency, because of our lifestyle, is to have more of a shortened state of our muscle fibers. So if a muscle has an ability to shorten and to lengthen, and we're always at a shortened state, even going from the shortened state to a neutral state, which is in relaxation, is a task. So you're really, in essence, not relaxing. That's a huge thing, even for the neck and upper back area, and that is what's being missed in pretty much most chiropractic and physical therapy offices, not because they don't know it, they're just following the protocol, whatever that is. So thanks for watching. Please make sure you subscribe to my channel. Check out my website. Better understand what postural neurology and functional movement is and why it's important for you to make sure you get it. Take care.